30 years from now, it's projected that nearly 1/4 of America's population will be 65 or older. The Age-Friendly Health Systems Initiative, a four-way partnership between the American Hospital Association and 3 other organizations, aims to improve health care for older adults by creating safe, evidence-based care that focuses on their needs. Now in its 8th year, Age-Friendly is a proven success and winning new converts every year. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. The Age-Friendly Health Systems Initiative hosts a free 7-month virtual training program for hospitals and health systems to learn about and implement its care model for older patients. In today's podcast, hosted by Rahat Ansari, Senior Program Manager for Population Health with AHA Center for Health Innovation, we hear the reasons Atrium Health Cabarrus in North Carolina decided to join the Age-Friendly program and the difference it's made for the patients who love it. Her guests are Dave Eaker, Geriatric Program Manager with Atrium Health, and Shannon Morton, Assistant Vice President for Patient Care Services, Atrium Health Cabarrus.
Thank you so much, Dave and Shannon, for being here with me today. I'm super excited to hear a little bit about your organization and the role that Age-Friendly played within your organization. So just to start off with, could you talk a little bit about what motivated Atrium Health Cabarrus to join the Age-Friendly movement?
We are super excited to be part of the Age-Friendly Health System initiative. It's something that truly started because this hospital and our healthcare system really pride ourselves on supporting the communities that we serve. Atrium Health Cabarrus is located in Concord, North Carolina. It is the only hospital in the county. So we serve this large, diverse, complex county, but we also serve numerous surrounding counties. And within our health system in the greater Charlotte region, we actually have the highest number of discharges of the Medicare population. So if you specifically look at 65 and older patients and discharges, we are discharging the highest number within our health system. So it was the right thing to do. We knew it was where we needed to go with our care. And it really started with our leadership team, our executive leadership team. Specifically, our facility executive said, we need to meet this population's needs and serve our community. We started this work in 2021 with a pilot of the 4Ms and reintroducing that to our hospital and the teammates that work here. And so it's definitely progressed from a pilot of the 4Ms work to a cohorted unit of geriatric patients to a lot of work in our community and with our emergency department specifically. So we're excited to be here to talk about that.
That's fantastic. And I'm just super excited to hear that this came from leadership. And, we've heard from other organizations the importance that leadership plays and the leadership engagement. It is so key. So the fact that this came from your leadership and started there, and I assume, you still have their support and they're right behind you and moving things along. I'm super excited to hear a little bit more about the ways that leadership had played an important role. So you all were one of our great shining stars in our action community. And I know that Dave had shared a testimonial about some of the work that you all had done and what Age-Friendly was able to do within your organization. Some of the things that Dave had mentioned were Age-Friendly helped to optimize processes, enhance patient care, and streamline some administrative tasks. Dave, I would just love if you could expand on some of those.
Sure. So for the cohorted unit, we were able to look at healthcare tech FTEs and then convert them into exercise phys FTEs to really focus in on that mobility piece. So since we've done that, we have seen a bump of 52% more mobility, and we actually had a 90% increase this year, month over month, for mobility on that unit.
Can you guys speak a little bit about how might your staff and how have the patients responded to this initiative?
So I would say that it's been overwhelmingly popular in our community. The word is out that we have a dedicated geriatric unit, that our emergency department is bronze status, geriatric emergency department, that we have resources here to meet this needs of the community. We have a very active foundation at our hospital that helps support initiatives, and they are contacted consistently by community members about this unit and everything that we're doing here. And they're seeking out our care. So we've also on the cohort unit seen a drastic increase since 2021 with our patient experience scores, specifically likelihood to recommend. We are exceeding target, and month over month, we're at 100%. So you can't get any better than that with likelihood to recommend.
Right. And that's a huge stat. A huge stat that I'm sure a lot of organizations are looking at because it's very telling. It is a very telling stat. So congratulations on that. So I did hear us talk a little bit about how you started with your pilot and how you have expanded, which is amazing and such a feat. Could you talk a little bit more about what do you see as your next steps in your journey?
A big part of our work on the inpatient side is to spread the 4Ms model to every unit within the hospital. So, the vision of our leadership team, the vision for Atrium Health, for Advocate Health, is to be the first and best choice. We want to be the place that you come when you want to receive evidence-based care. So we want to do that here. We want to, no matter where you come in this hospital, no matter where you're admitted, what your disease process is, that the care team caring for the population of 65 and older, that they know how to provide that 4Ms model of care, and that we have resources aligned with each of those 4Ms. So we're doing that. We have a dedicated cohort unit, as we've discussed, but we're spreading the 4Ms model to other inpatient departments. So that's our next big step from an inpatient perspective. I'll let Dave share the focus of the emergency departments.
Yeah, so just as I started last November with this team as our geriatric program coordinator, one of the tasks was to help the ED to get the ACEP geriatric bronze designation. Received that in March, but the continued work we're doing now is to be able to submit for silver for Cabarrus this year. And then we have two freestanding EDs connected to us in Kannapolis and Harrisburg. And I have also submitted for a bronze application for them as well. But then our ultimate goal is to get gold, obviously, right? So we are working with our advocate partners and other people within our health system that have achieved gold and trying to see what we can do to follow their best practices. Even though I'm submitting for silver this year, we're working on action items to get us towards gold because we know it'll take a while to get those things implemented.
And Dave, for some of our listeners who haven't yet made that jump to the geriatric ED realm or looking into that, could you just talk a little bit about what the different status is and how one might approach that?
So that's through the American College of Emergency Physicians. You can go to their website. For bronze, they need you to do at least 3 criteria. And so what we picked was a protocol to minimize urine catheters, to minimize NPO status, to minimize physical restraints, and then also to do a full med rec on our geriatric patients when they come into ED. Moving into silver, there's more protocols you have to put in place, looking at different specialized screenings you can do for your patients as they enter and leave the ED, specialized equipment, and also referrals to like palliative care, psych, and also using volunteers in the ED. So each level, there's more things you need to do with changing the environment, adding more protocols, and then just looking at the equipment and supplies you have available for your geriatric patients on admission and coming through the ED, but also when you're discharging them, are you connecting them to the right resources in the community? I know we talked about the exercise physiologist in the beginning, so the only other thing I was going to talk about was the geriatric nurse practitioners. We do a geriatric nurse practitioner consult, and then they started 2 days a week, and now we're up to 5 days a week. So just seeing that grown, if there's like hard to place patients, if we need to look at polypharmacy, or we have patients with delirium, we're able to consult them to see the patients. And to go from 2 days to 3 days now, moving into October, to be able to be at the hospital 5 days a week, that's huge for our patients and also helps reduce our length of stay as well.
Well, thank you for providing a little bit of that context. And Shannon, I just wanted to pause to appreciate the answer and response that you provided with the vision and the mission that you all have. That is so important. And when you think about older adults that you love and you care for, or, you spend time with, you want to make sure that they're getting the best care. So I love that that's your mission and you proudly share that so that everyone can feel comfortable with bringing their loved ones to get care at your facility. So one more thing that I wanted to touch on was Could you share a little bit about your leadership engagement? And I understand where this came from, and they identify this as something that should be done within the facility. Could you just talk about how they've supported you and in what ways, and how so that other leaders who might be listening in could glean some other ideas on how they could support their teams that might be embarking on this journey?
This work aligns so nicely with the mission, vision, values of Advocate Health as an enterprise. We're a very large organization, but here locally, our facility leaders really have driven this work. It was their brainstorm, their idea to focus in here, and with that, they have given us their full support. I think being able to be on the journey as an age-friendly health system has also been very helpful because we've been able to collaborate with best practice leaders across the nation. It's helped us connect with folks that we might not have been able to connect with. So, the leadership support of these initiatives, you can't compare it to anything else. Because of our leadership support, we've been able to continue the growth of this program. Dave's role was created because our leaders were committed to geriatrics at this facility. It was a role that was not in existence before we started this journey. We actually have dedicated geriatric pharmacists across the facility. They've all received training in geriatric care and medicine.
Oh, wow, that's great. So they can kind of, they're a resource across the entire hospital, so they can bring some of those learnings to each department that might not already be age friendly.
Correct. And it helps align with that vision we talked about of no matter where you are in this facility, if you're 65 and older, you receive that best practice care. The exercise physiologists that we mentioned, the impact that they've had on mobility. A lot of times leaders don't want to talk about creating new positions and bringing in new roles, but this was a role that was an easy sell to my leadership team. We had a problem with falls, we had a problem with mobility, and the exercise physiologists were directly involved in reducing our falls on our cohort unit by over 50% in 2023. So we've seen great improvements. All of it's driven by our leadership, their connection to our mission and vision, and that constant support that brings us back to that. In addition, we're blessed with an advisory board for this facility. Again, they're made up of community members. So our community members and our advisory board, they are invested. This is the hospital that their family comes to, where they seek care. So they support us wholeheartedly in anything and everything that we need to do.
So from what I gather, it doesn't sound like there was too much convincing that needed to be done for some of those roles. But if an organization did need to kind of go down that route, I don't know if you've seen some of the resources that we have out in terms of the business case and the ROI calculator. Did you use those at all? And if not, because you didn't have to, do you feel like that would be beneficial to other organizations, and or any tips that you might have for an organization that might need to do a little bit more homework to sell this?
Definitely, this whole project has been years in the making, and it is not all hearts and rainbows and easy. It was work. It was changing culture. It was redesigning units, changing the population that an entire 28-bed nursing unit served, the focus on geriatrics. So that came with a lot of persistence, hard work. Yes, we had times where we struggled. The action community, what I can say, before we had Dave, it was myself trying to lead a lot of this work, and the action community was a lifeline a lot of times because I have never walked in these shoes and led a project like this, and so I was able to access resources, listen to presentations, see the best practices. The 4Ms model is really easy to digest, and it's something that you can do with minimal resources. You don't have to have geriatric pharmacists to provide medication reconciliation and to really assess and look at the medications that you're providing to your patients. It's obviously a plus when you can do that, but you really, the action community and the resources through the American Hospital Association have really streamlined it and helped it be digestible, and they help really prepare you for the business case to proceed with these types of programs.
Coming new into this role, I think it was very beneficial. Being part of the action community, not only was I able to learn a lot and see best practices out there, I was also able to share kind of what we went through on our journey. And I thought it was so beneficial that I went ahead and signed up for the next season of the action community. So I will be on there this year as well, for sure.
That's another real good learning that that we share, and some questions that we get asked often. Hey, we joined the last action community. Is it okay if we join the next? Of course. We're always going to be having new learnings, new experts sharing, and this work continues to evolve. One of our leaders shares regularly that when you're trying to bring something to an organization and need to maybe do a little bit more convincing to your own leadership, it's really important that you pause and listen to what their needs are and what's on their docket. And knowing that age-friendly, and I'm sure you all can understand after living it for quite some time and seeing the impact, but age-friendly can very well be the solution, or at least part of the solution, to many of those issues with boarding issues in the ED and workforce shortages and, enhanced patient care and patient safety. Those are all things that we regularly see that are positively impacted by age-friendly care. And, when you hear, I think it's important that you reframe it and listen to what your leaders, what's on their plate, and then reframe age-friendly to be the solution to that, because we know that it is, and sometimes it just needs a little bit of reframing to be able to, get that point home. So thank you for your time today and for sharing your insight, and looking forward to seeing you in the next Action Community.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.